Thank you very much indeed, David. We have just about sort of 6 or 7 minutes for our two discussants to respond to some of what Paul and David have been discussing. I'm going to pass over first to Jack Campbell, who is an advisor for the UK's Department for International Development on disaster risk reduction and leads DFID's relationships with other key actors in the DRR area for DFID. So first of all, Jack, just sort of 3 or 4 minutes, if that's okay. There's a lot of issues to cover in a short time, but I'm sure there'll be a chance to pick up on other issues in the question and answer session as well.
Yeah, start the clock. I think it's there's so many questions that are thrown up and a lot of challenging issues for us and as a donor, I guess, but I think for the humanitarian community as a whole as well. I mean, overall, I think that really welcome this, both presentations and this report. It's really timely, I think. It ties a lot of loose ends together in terms of the particular agenda I've been working on, disaster risk reduction. Obviously, the kind of key framework and point of reference for that agenda is the Hyogo Framework for Action that was mentioned earlier. But I think that we're seeing now, particularly with Copenhagen and the negotiations, a real need to tie the policy links and the programme links between the adaptation agenda, the DRR agenda, humanitarian reform agenda. And I think a lot of it centres and circles around, how we're building resilience at a national level and below. And I think the presentations so far have demonstrated that we've all got common objectives. I think that it's timely, particularly for DFID, from my perspective anyway, on a number of counts. Firstly, I guess there's a value for money sort of discourse at the moment. How do you most effectively and most cost efficiently save lives, save livelihoods, and meet humanitarian need in times of disaster? I mean, obviously, the value for money cuts across everything that DFID does. And I think this particular debate is a critical one because it really gets to the heart of how we are we most effectively meeting humanitarian needs? And would a reorientation of our priorities and the way that we work with governments, but also with domestic civil society, would that lead to sorry to talk in cost terms, but a more cost-effective way of meeting these increasing humanitarian needs? It's also timely in terms of DFID's research agenda. There's a massive interest in asking the question about whether we've got the right balance between funding for humanitarian response versus proactive kind of risk management. And starting to really look at the respective mechanisms that we have in place that don't necessarily talk to each other as much as they should on the response and the response architecture, Central Emergency Response Fund, etc., versus how we are funding governments and local civil society to better manage disaster risks. I spotted a lot of challenges in those presentations. One being how we even analyse capacity and how we decide and whose decision is it that a particular country's capacity has been overwhelmed. We're obviously talking about politics here, and that decision is a political one as a technical one. So that's a huge challenge for the likes of DFID. I just wanted to, I guess, make some distinction between we've kind of interchanged the phrase national capacities and state capacities, and I guess slightly uncomfortable with this notion that, I mean, obviously the state has primary responsibility, but we want to look equally at the interaction between the state and the frontline responders, which quite often are non-state. And I guess that could be something that comes out stronger in any follow-up work. You mentioned, Paul, the kind of question about whether we should consider more direct budget support to governments and directly funding national disaster management agencies. I mean, DFID certainly has funded directly national disaster management agencies as part of its DRR programme of work, not through a direct budget support mechanism, but it's certainly been something that's been part of what we've done. It's not out of the realms of possibility that we would consider direct budget support, but that is a very new idea, and I think direct budget support as a aid instrument is going under a certain amount of review, and there are obvious challenges with that as an instrument. So it's one that is on our table. And the point raised around principles was another interesting one. It strikes me that the sort of fairly simple table you put up in terms of the different focuses of the different principles you mentioned there are obvious tensions, but to me they add to each other, and your report kind of reaffirms the need to take a bit of a more nuanced approach to applying those principles, and to really sort of understand how we're working differently in different contexts, fragile state environments versus states where there is both the will and the capacity to protect citizens.
30 seconds.
Yeah, I'll pass on to Debs now. I'm sure you've got lots more.
Thank you very much, Jack. Deborah is a humanitarian specialist, also at DFID, working with the Chase operations team, the Conflict, Humanitarian and Security Affairs Department's operations team. And Deborah has a background in health, but has worked in all sorts of aspects of humanitarian response in many major humanitarian operations over the years, so a lot of experience to draw on, along with Jack. So I'll pass over to you, Deborah. Thank you.
Thanks, Sarah. Have I got about 30 seconds to make all my points?
I'll give you 3 minutes, to be fair.
Thank you. Thanks to Paul for the presentation and the report, and also to David, which I have to say Jack and I were reading it last minute this afternoon and comparing notes, and we've had so many points we wanted to make this afternoon. And I think, as Paul knows, we were lucky enough to be involved in some of the research that has contributed to this report, and lucky enough also to get Paul in to give us a preliminary overview of the draft findings. And it's stimulated, with all honesty, a lot of debate in DFID. And it's still stimulating a lot of debate in DFID. And I think, as Jack alluded to, we're actually at a time now where there's a lot of re-evaluation going on about the way that we do business, not just in humanitarian affairs, but in transitional scenarios, in fragile states, in development, etc., etc. And I think this report and the central pretext of what is the role of the affected government is going to be central to that debate in many respects. I think in some ways, we have to be realistic, and in humanitarian response, we can often make it far too complicated for ourselves, but essentially we're dealing with a state or states that are either unwilling or unable to meet their initial needs of their populations. Now, if they're unwilling, that's one scenario. If they're unable, that's the kind of scenario when it's easier for, as a donor government, us to say that we need to be thinking about the humanitarian imperative and getting in there as quick as possible. How do we assess the capacity of the affected state to meet its own needs? I mean, as responding on behalf of a government, obviously, then we're taking the lead from the affected state that they are giving out to us, whether they're asking for international assistance or not, or if they can be more specific about the international assistance that they are asking for, is one of the indicators that we would use. And quite often we will have either offices in country or regionally that are working there and are able to give us much more detailed information from their point of view. I think it's fair to say that quite often in humanitarian response, as the report points out and as Paul has reiterated, we probably do underestimate or bypass what the capacity is of a state. But if we're in a humanitarian response where lives are literally at stake, there is an issue of getting in there first to see what you can do in a coordinated way, as opposed to stepping back while you assess. I don't have the answers to that. I don't think DFID has the answers to that. I think it's something that, as an international community, we should be working a lot harder towards, and I'm sure people are aware that there are lots of initiatives going on, and most notably what OCHA is doing at the moment and the IASC on needs assessment in emergencies, which we hope will take into account more of states' own capacities. Conscious of the time and going off the point, maybe I'll stop there.
Thank you very much.